The next couple products I'm going to go over are knee immobilizers and a post-op knee brace. So a post-op knee brace can be used to immobilize the knee as well as allow different ranges of motion of the knee, whereas a knee immobilizer is only going to lock the patient out at 0 degrees. So this comes in a box. I already pulled that out of the box, and we'll open up. There's going to be a little egg carton thing here. I'll show you that in a second. But I asked Candy to get up on the table because I prefer to fit a patient for any type of knee immobilizer or post-op knee brace with the patient either supine on the table or laying down all the way, short sitting or all the way down. This has multiple sizes and lengths. So this is a 20-inch length, which tells us how long the knee immobilizer is, but it comes in a universal. So it's a universal in girth. So what that means, we have a 12-inch, a 14-inch, a 16-inch, 20-inch, 22, 24-inch in lengths. And then universal is the girth, so how wide that gets. You will fit most every patient in a universal, whether they're really petite or big. But putting it on correctly is the biggest thing. You don't want to just take it out of the box and slide it on the patient. One thing I'll point out is you'll see there's actually a little curvature here on the posterior side of the knee immobilizer. That is actually going to go right in the popliteal space. So I'm going to take off each stay on each side. So there's a bilateral stays. Those come off, and that's why we can accommodate wider or thinner legs. I'm not sure if this helps see. You can see the contour in there a little bit. It's not crazy, but that is where we want to make sure that goes right behind the knee in the popliteal space. So you want to lay back or sit? Your abs might be working out here a little bit. All right, so I'm going to lift her up, and again, I'm finding that curvature portion there right behind. Now, why we take off the stays on each side, if we had a patient who were bigger, basically we want to make sure that this gets longer or more girth can be contained. But for Candy, we want to make sure we adjust these stays and they go right in the midline of the leg. So on the medial and lateral side. So on the lateral side here, I'm just going to stick that. It's going to Velcro right onto there. And I'm going to do the same thing on the medial side, which you won't be able to see, but basically right on the midline of her. And then I'm going to start Velcroing the straps from distal to proximal. So one thing I took out first was the egg carton here. I'll talk to you about that while I'm strapping this up. The egg carton is used in some people who want to use it. They will actually take off, there's a little peel and stick, peel this off and stick it in the posterior, right where that crease was. That just gives the patient a little bit more cushion in the popliteal space. I don't prefer to do that because when I put something back there, it's not going to allow them to get to 0 degrees and it's not going to fit as well. So as I continue on with this, there are 5 straps, 4 that are actually holding the brace in place, and the last one just goes across the top of the patella. A lot of the times I will actually not do this strap if it's bothering to the patient, if it goes right across their patella and cause them an irritation. So that you could undo or leave and tuck it in. So that is how we put on the knee immobilizer. I'm going to take that off and show you how to use a post-op knee brace. Goes on similar, but some differences. Toss this out of the way here. So before I put it on Candy, I want to show you a couple things. So this also, this comes in a bag. I pulled it out. It's universal, so it'll fit a left or a right, and it's universal in size, meaning I can make it longer, I can make it wider. What I like to do when I take it out of the bag, there's a little hinge, red stop here. I like to lock that out. Right now it is locked, but usually when they're shipped, they're unlocked. So when I pulled it out, you'll see the hinges kind of flop around here. I think that's more difficult to fit the patient when that's moving around, as opposed to have it put it 0 degrees, push that little red lockout tab down, and that helps it from sliding all around and and flexing while you're trying to fit the patient. Not sure, can they see that? All right. So if you could look at that red tab, will lock out at these 5 different angles: -10, 0, 10, 20, and 30. So the red portion on the inside there lines up with that red mark, and that is basically putting a little pin in between the hinges to restrict the hinges from actually bending. So if you happen to try to push it down and you can't get it down, it's probably because that red lock is right over a tooth. So either straighten or extend or flex the brace slightly, and you'll be able to push it back down. And that goes for when the patient's actually in the brace as well as out of the brace. So I like to lock that out. And then the last thing I'll show you before we put it on, the hinge is adjustable as well. So if I were to unlock that, it's going to default to whatever the settings are set on the extension side of the hinge and the flexion side. So right now I have it set going to 60 degrees of flexion, and it's actually at -10 of extension. So I don't want them to go in hyperextension, so I'm going to pull that up and slide that down to 0. So this just pulls up, and you can slide it, and it pushes back in to whatever level you want, whatever angle. And let's say I wanted to go to 90 degrees on flexion, pull that up, slide that, and it's going to go down to 90. Now, I did that on one side. I'm going to lock that hinge out again, so it's not going to be flexing around. I also need to do that the same on the opposite side. You don't want to do one and not the other. So I'm going to 0 and 90. Now, most of the time when you're putting these on a patient post-operatively or in an acute setting, you're going to have them locked out at 0. There's a way to kind of double lock it to ensure that if they unlock that hinge, they're not going to flex at all. You can actually set your extension setting, it's upside down, extension setting at 0 and your flexion at 0 as well. So I could pull this in all the way up to 0. So now even if I unlock that, I'm still locked at 0 because our flexion and extension settings are also set there. So the quick lock, the red quick lock, is the easiest way to do it, but to be double secure, you could do both of those. I'm just going to move this back to 90. Next thing I'll show you is I want to make sure that I get this brace as long as I can that's be comfortable on the patient, meaning I want to extend out. Usually it's going to be the distal portion of the brace. I just push this in and this will slide out. That, I'm going to go over here to Candy to look real quick. I want it basically, I'm just going to show you with the one hinge. I want it to come all the way down, if I can, to right above her lateral and medial malleoli. If not, it does slide down. These braces typically like to slide around if you don't take the time to fit them correctly. The proximal portion is adjustable as well. So that is something you can adjust as well. Most patients, you're not going to be able to adjust this much because if I go too high, you'd have to do it on the medial side too, and that's usually going to be up in their groin a little bit too uncomfortable. But if you have somebody who's tall, that is something that you may adjust quite often. So I'm going to push that back down, just go up one level there on the inside and outside. Now the reason I'm going longer on the brace and why I want to extend it out as far as I can, one is for suspension, meaning I want to make sure that this double padded portion is riding right on her lateral and medial malleoli. That way it's going to help suspend the brace. The next reason is the longer the brace is, the more leverage and the more stability the brace provides. The other thing I can do is I can adjust the second strap on either side. So I can move this strap down too. If I wanted to, I could push that down. Same thing on this side. Just push that in and it'll slide up or down. I'm going to leave it where it's at now. But what I like to do is check to make sure I have the length correct on the patient. That's as long as I want to get on her. Now, what you'll see is when you put this on a patient, if you don't take the time to actually adjust this lengthwise, you'll see that there's going to be a pretty big gap between the lateral hinge and her lateral condyle. The opposite is going to happen on the medial side. You're going to have pretty good contact, not a lot of gapping. Now, there is some gapping, and we want some gapping on a post-op brace to accommodate post-op dressings, but the reason we have a larger gap is as I said, this is a left and a right brace together. So same brace I'm going to put on her opposite leg. I would have that gap on her left side. It'll be on the left lateral gapping. But again, that hinge was on the medial side. It's because the angulation of a knee. So a normal knee has about 4 degrees of valgus. Most people will have that bigger gap. To accommodate that, after I lengthened it out, I'm going to actually take and manually bend that hinge in some. That's going to help suck that hinge over to the lateral side of her condyle. The other thing I want to show you real quick, I may have skipped over. The red lockout button is going to go proximal. So I don't want to make this upside down. That'll be way too long in her groin. But the red is closest to the heart. That's one way some people remember how to put it on. So I like to also have the straps all the way stretched out like they are, as opposed to being real tight and snug. Again, I think it's easier to tighten on the patient than it is to loosen it. So I'm going to pull these straps all the way back. They come like that typically, so it stretches out. So I'm going to have her lift her leg up. I'm going to set this underneath her. And then on these straps, there's basically a little buckle and a hook on the other side. But I can't pull this strap now because there's Velcro holding it in place. So these little tabs, little trap doors, Velcro open. I'll show you. I'm just going to flip those all down. That allows me to adjust the straps as needed. So this is one where it's nice to have 3 hands. So Candy, can I have you sit up and just hold that in the right position? So I'm going to pull this as snug as I can, take all that extra slack out of the posterior portion. You're going to notice this is really long. So I'm going to now pull this off. I'm going to put that little hook or that little loop on the hook side here. And then Velcro. I'm going to shut the little trap door and Velcro this closed. This is something also, just like with the sling, we can take out a lot of extra material. These are made for patients all different sizes, but if you don't trim them, they're just going to have really, really long straps. So on this one, you'll see this is a good example of where I would definitely want to trim. This is coming all the way around to the front again. So what I would do, I didn't bring a pair of scissors. I would basically take off the little alligator Y-tab. I will cut some of that material off. I'm going to pretend that was cut. I'm going to put my alligator Y-tab back on, and then that will Velcro posteriorly. Now, I'm putting this on too tight. This is a good example to show you what not to do. Basically, what's happening is those hinges are kind of torquing in. So I'm going to loosen these straps a little bit. And that allows those to actually slide. I probably have this one too tight. I want those upright on the midline, but I don't want the hinges turning in or outward. If it's going outward, it's too tight on the posterior side. If it's going inward, it's too tight on the anterior side. So we want it just straight. I did not put a big bend here, so you're going to have a little bit gapping there still on her. But just to get out of the camera view here, pulling the extra slack of the straps out of the posterior side. I'm going to then shut that little trap door on each of these straps. So that stops the strap from going backwards. And then continue with the little hook, buckle, and tighten this down. And that is how you put on the post-op knee brace. That's all.